Functional Diagnostic Nutrition, or FDN, is the science of treating illness a better way. It addresses and corrects underlying malfunctions in the body, which are the root causes of your illness. This always results in improving your health and often results in a full and permanent resolution of your illness. As a matter of fact, as a doctor for over 40 years, I am living proof that it saves lives and eliminates chronic disease in most people. You can read my survival story at drtj.ca for all the details. But for now, let me tell you why learning about the FDN approach to illness is going to be one of the best things that ever happened to you. Let me explain. Doctors, including me, are taught to diagnose diseases, which really amounts to giving a group of symptoms a name. We are then taught to treat this group of symptoms with a drug. While this may provide some relief, the additional side effects of the drug often cause even more issues. The key to understanding this is that you are then treating the symptoms only. The root cause persists. Treating symptoms can't possibly resolve your illness. Your illness continues, and you continue taking medication, often until you die. As a doctor and an FDN certified practitioner, I can tell you there is almost always a natural solution to any and all diagnosed health conditions or diseases. When you find out why the body is not functioning properly, you have all the information you need to heal your body from the inside out. FDN is based on special tests that look at the functioning of the body, seeking to find what is not working properly. The tests we do are not generally done by doctors. The principle we work from is quotation marks, test, don't guess, end quotation marks. Let me give you a concrete, specific example of how this truly works on any condition. Let's look at the diagnosis of depression. Do you know there is a better way to treat depression? My name is Tom Johnson. I have been a practicing family physician for more than 40 years. For many of those years, I treated my depressed patients with antidepressant medications. Sometimes the medication helped, but often it didn't. Rarely, if ever, did my patients feel back to their normal selves. To add insult to injury, they generally felt horrible, often for more than a month, when they stopped their medication. Eventually, the same depression would come back. Frequently, I would then try a different antidepressant medication, and then another and another. Sometimes I would try 2 different antidepressant medications simultaneously out of desperation. But what if depression isn't really the diagnosis? What if it is only a symptom of the problem? What if we found out why the brain stopped functioning properly and fixed it? Understandably, you say, what do you mean? Aren't the treatments for depression recommended by physicians the best treatment? The right treatments? Let me give you an example. One of many possible causes of depression would be a low vitamin D level. Depression is a condition where the brain is not working well. Vitamin D is critical for brain function. One company's vitamin D bottles advertise that approximately 11 million Canadians are deficient in vitamin D. Vitamin D deficiency is rampant, so there's a good chance you are deficient in vitamin D also. It's easy to fix. Fixing it causes no harm. On the other hand, not fixing vitamin D deficiency has a catastrophic effect on the functioning of your entire body. Only 2 substances that I am aware of go into every one of your approximately 50 trillion cells, and then go into the nucleus of every one of your cells, and then turn on or off 5,000 to 10,000 genes in every one of your 50 trillion cells. Thyroid hormone and vitamin D. So if your vitamin D level is low, it means every one of your cells is malfunctioning. So, it looks pretty straightforward. Check your vitamin D level and take enough vitamin D to get it into the normal range, right? No, wrong. When you obtain your lab test result for vitamin D, it will show the quotation marks normal range and quotation marks beside your vitamin D level. However, it has been clearly demonstrated that our brain needs much more vitamin D than the lower limit of the normal lab range to function properly. Unfortunately, many MDs and health practitioners are not aware of this. As a consequence, many people with proven vitamin D deficiency are told their vitamin D level is normal. Then the problem continues. So, what if you thought of depression a new way? Depression is not the problem, but only a symptom of the problem. The real problem is vitamin D deficiency. If vitamin D deficiency is the main reason you are experiencing depression, and it is corrected, not only will your depression resolve, but the rest of your cells will now resume normal, healthy functioning also. Not only your brain, but your entire body will start to feel good again. Vitamin D deficiency is just one of many possible underlying causes of depression that can be successfully remedied with natural treatments. So as you can see, treating symptoms like I used to do can't possibly heal you. It will only keep you sick, causing your health to deteriorate and resulting in ongoing symptoms and pain. On the other hand, when the underlying causes of your illness are addressed, your body can't help but start to actually heal. Imagine truly healing, not just dealing with your symptoms until they come back tomorrow. Wouldn't that be incredible for you? Isn't that really your direction, the path you want for your life? You will start to feel better, gaining vitality, energy, and the peace of mind that comes when pain and your other symptoms resolve. No more drugs, no more missing out on your life. So now you know there is a better way, and it's waiting for you to take the first step. Would you like real answers to your health problems? Would you like to feel well again? Would you like to enjoy your life again without the suffering you are dealing with now? If you answered yes to any of these questions and would like to know more about an FDN approach to your illness, then I encourage you to visit my website at drtj.ca for more details. Once there, you will learn even more about how FDN is different and how you can schedule a free, no obligation and no cost to you consultation with me. I'm on a mission to help as many people as I can with the knowledge I have from over 40 years as a medical doctor and one of the very few FDN practitioners in Canada. Imagine what your life will be like when you feel like the old you. Go ahead, learn more at drtj.ca, then schedule a time to speak to me about your exact issues and see if I can help you regain your health. See you soon. Dr. Tom Johnson, Certified FDN Practitioner.